The COVID-19 epidemic has rightly challenged us to come up with ways and means of delivering the best possible care to our patients in the safest possible way. So I think we have to and have moved very, very quickly to telemedicine, telephone consultations, consultations via the internet, using remote technologies to keep our patients at home. I think we've encouraged our patients to shield so that they are not being exposed to many other people. And clearly that's been part of the global UK response. Other things that we have done is give 2 or 3 months of therapy, where previously we might have only given 1 month of therapy for our oral therapies. I think we switched some patients from systemic therapy to oral therapy. We have looked at reducing the frequency of administration of systemic therapies. And obviously, we are looking at subcutaneous daratumumab instead of intravenous daratumumab in some of our patients. We've also possibly looked to postpone standard risk transplants or auto transplants for standard risk patients at the height of the epidemic because there were concerns about bed numbers and potential ITU bed space, although we have continued to transplant our higher risk patients who are most likely to benefit from transplantation. And I think it's very important that we reassure our patients that if they need to come to hospital, we can make it as safe as possible too. So appropriate care of patients when they have to be an outpatient or an inpatient. We have also looked at cohorting so that in our centre, no COVID-19 patients are admitted. They are admitted elsewhere where they have dedicated COVID facilities. So I think the UK community has moved very quickly, and we have looked at everything we can do to make our treatments safe, but not lose efficacy. The other things that we have particularly looked at are dexamethasone doses. There is concerns that dexamethasone particularly is an immunosuppressant. So reducing the doses of dexamethasone that our patients receive, if it's safe to do so, is also been a very important part of our strategy.